Welcome to today's Health and Wellbeing Roundtable, sponsored by California Schools VEBA. I'm Sandra Moss, and I'll be moderating our panel of experts who will address some important questions related to health and well-being and share their valuable insights. In our discussion, we will provide tips for individuals starting their health journey, discuss daily habits for long-term success, and address common health misconceptions. Additionally, we will cover topics such as preparing for a doctor's visit and effective communication with your doctors. We will also delve into mental health strategies, signs of normal challenges, indicators of more serious issues, and ways to approach conversations about mental health with your loved ones. Let's begin by meeting our panel of experts. Dr. William T. Sang is a board-certified internal medicine physician, assistant area medical director, and assistant chief of staff at Kaiser Permanente, San Diego. Dr. Sang earned his medical degree from the University of Utah School of Medicine and completed his Master of Public Health and Internal Medicine residency in the Johns Hopkins Health System. Dr. Sang is a member of the American Board of Internal Medicine, the American College of Physicians, and the American Medical Association, and is on the executive board of the San Diego Medical Society. Also here today, Crystal Powers is a licensed marriage and family therapist with Optum Health in San Diego. She has 18 years of experience working with people seeking mental well-being, and she specializes in treating anxiety, panic, trauma, depression, and grief. Crystal works as an Optum Emotional Wellbeing Solutions dedicated consultant for California Schools VEBA, where she helps guide people through challenges like life transitions, relational issues, family and parenting concerns, and workplace stress. And finally here today, Michelle McNiff is a board-certified integrative health and wellness registered nurse specializing in functional lifestyle education. She has more than 30 years of experience as a critical care nurse and is the founder of Blue Heron Holistic Incorporated. Michelle is a California Schools VEBA Care Navigator, where she uses her wealth of diverse nursing experience to educate members and creates tailored plans to help them achieve their optimal health. Dr. Sang, let's begin with you. We all know that navigating the healthcare system can be tricky and challenging at times, and a lot of people took a break during the pandemic. But you say they're coming back now, right?
We are getting back to health. We need to catch up. We need to get our screening done. We need to take care of ourselves. So yes, coming back is difficult, but we need to take that first step. And I would say the best advice is don't do the, oh, by the way, don't do that at the end. Do that at the beginning, because these are really the important questions that you want answered. So prepare for it. Make sure you have the list of questions ready, and don't wait till the very end. We want to address your issues up front.
That's called burying the lead in journalism.
That's right.
Don't bury the lead. If you've got an issue, what about some tips that you have to offer in that regard, Crystal?
So I encourage people to come in with a list of notes, things that cross their mind between sessions, because often once you get to the session, you forget what you need to say. And so that's really important to come prepared. It is an interview for your therapist as well. We want you to be comfortable.
Let me ask you, Michelle, about patients preparing and feeling comfortable with your provider. That's really important too. You really have to have a good rapport with your patient or the person who's coming to see you. How does a patient or a member get that same sort of feeling and connection with their healthcare provider?
I think it's very important to feel comfortable with your provider and making sure that you bring that list and come prepared. And know that being an empowered patient, asking the right questions, being open with what's happening in your life is really important and helps with that connection in both ways.
And connection is such an important word. Dr. Sang, I'm sure you try to make connections with your patients. What advice do you have for them to make them memorable to you?
From a patient standpoint, you need to make sure you have the right provider. It doesn't matter who it is, but you need to have the right provider. And it's not like you make a perfect connection every single time. If it's not the right connection, if you're not feeling that vibe, if you're not getting that understanding, it is okay to switch physicians or providers. It's really making sure that you get what you need, you get heard, and then that you form this pathway together. It's not about one or the other. I'll just kind of throw something out there. When I was in training, my professors would be in front of books, and they would practically say, if you keep smoking, you're not my patient. And it did work for a little bit, but that's not the world we live in anymore. It's a partnership now. I think back and go, well, that technique worked for her, but what about the people who never came back? They were missed, right? So right now, we understand that this is a partnership, meaning that you do have to bring your list. You do have to let us know what's going on. You need to connect with us just as much as we need to connect with you. It's a together type world. We have the shared experience, and we need to move together.
Crystal, in your experience as a provider in marriage and family health, getting that connection, how do you draw it out of people?
Yeah, I really encourage people to be very informal in therapy. People tend to come in feeling like they need to be a good or a whole person. And I really encourage people to share their biggest fears, their biggest concerns, and largest anxieties so that we can actually make progress. I really view treatment as being active. So rather than a blank screen in therapy, I really prefer to have a dynamic conversation, a real authentic conversation with people.
I think you really need to make sure you have that trust. If you don't have that trust, if there's some questions, and maybe that's time to change, you need to have that trust, because the work plan doesn't work if you don't follow it. It's just a plan then. It's really not a pathway to health. So you need to develop that trust. If you can have that, then you can build from that. So that connection is so important.
I think we all know what the red flags are. We all know when something isn't working, but what about the green flags? When do you know that you really have a doctor that's the right one for you?
I think the most important part of a visit is really treating that office as a sacred space, right? It's just you, your patient, and that's it, right? Nobody else. And if you can feel that, that connection, that listening, then you can start to move toward the next line. And listening is, medicine is a relationship. Medicine is relational. It's not transactional. You need to feel that you're being heard, that they understand you, and that you're fighting for your wellness. So that part, that's the green flag. If you can feel that, and the connection is part of it, but listening is the way to get there. So make sure that you're heard.
And your healthcare provider should be asking you a lot of questions too, right?
Right.
So, Crystal, what is one tip that you would give to someone just starting their healthcare journey? I guess we're transitioning to preventative health here. We really do have more power than we know when it comes to staving off illness and disease. What tips do you give to your patients in terms of preventative care?
It really is about mind-body wellness. There isn't anything that we do in our mind that doesn't impact our body. And so one of the tips I give is really pausing throughout the day and doing very present-minded check-ins. So where do I feel things in my body? We rarely do that. We're overstimulated, we move quickly, and we rarely check in with ourselves. That is the place to start. I also recommend scaling. So, on a scale of 1 to 10, how is this feeling? Can I name an emotion? Those are the types of notes that I ask people to bring to sessions so that we can work on any themes or patterns.
Because we get so much information from the internet, and Dr. Sang, I'm sure you probably could write a book about some of the crazy things that you hear from your patients. What is your advice?
I do think the information on the internet can be really valuable, and democratization of knowledge is important. But what you want from us is your wisdom, the experience, to go beyond that knowledge, because knowledge alone is not wisdom. Wisdom is the experience of centuries of physicians, passing that on. And I tell my wife exactly what I tell my patients. You got to get your preventative stuff done. 40% of cancers can be prevented just by detecting it early and taking it out. You have to pay your body back. It's given you years of health. We got to invest in ourselves. Think of ourselves as priority and kind of give it that needed attention.
And that needed attention, what are some tips that you could offer to people to help bolster their health in a natural, simple way? I guess stress is something that causes a lot of ailments, clearly. What advice do you have for your patients when they come in to talk to you?
I recommend having definitely two things. Long, deep breaths whenever they can, and then a consistent practice of writing 3 things down that they're grateful for. And that a lot of times is a good way to start in this mindfulness and awareness journey to shift your physiology, really, shifting your mindset and reframing where you want to go and where you want to be.
So how do you, in your practice, work with patients to kind of bolster their confidence in taking control over their health and well-being?
I really do like to empower my clients to identify the core goals that they would like to achieve. So part of therapy is very process-oriented. We're talking about our feelings and our thoughts, but the other piece is incredibly strategic, and it's about coaching. And so right from the start, we kind of zoom out and talk about what we're looking to achieve in the next 6 months or 9 months, so we can create concrete goals around those things.
And when it comes to wellness, are there everyone knows, don't drink too much alcohol, don't smoke cigarettes, try to get enough exercise. What are some simple, everyday things that people can do outside of the box that can stave off illness and disease?
I want to kind of go back to the framing of things. Framing a paradigm is really important, because in terms of healthcare, the way your thoughts will turn into physical ailments. We know that. Stress, too much stress will turn into physical ailments. Physical ailments will lead to mental illness as well. So it's a cycle, and you need to understand both. The things that you can think out of the box is really simple. We've heard some of that. Just deep breathing, box breathing, things like that can kind of change your mindset. For me, it's very easy. I said, please don't fight over the parking lot next to the entrance. Park a little further away. It's okay to walk a little bit. So incorporate all everyday things into your life so that it's not something extra. I mean, we're all busy enough. Just build it into your daily routine so that it becomes a part of your day.
And what simple tips do you offer to the people that you deal with in your practice on a daily basis?
I usually suggest for people to get outside, get out in nature, get their feet on the earth, and have food that is alive, food that is whole. Remember something that they liked as a child, a fruit or vegetable, and incorporate that. Simple, fun, making it fun and simple.
And we truly are what we eat, aren't we?
Make it fun.
Crystal, any thoughts to add about that?
Yeah, I think it's really important that we're also adding to check in with our loved ones and family members, because oftentimes if someone is beginning to struggle, they start to isolate or cut themselves off. And so sometimes they need a reminder as well.
Well, let me ask you about some of the tips. There are some common healthcare misconceptions that we frequently encounter, or maybe you hear about in your practice.
I have a lot, but I think my pet peeve is really the flu shot doesn't work for me, or that flu shot gives me the flu. I hear that a lot. And it doesn't. It doesn't. We have the data to support it, and the flu shot does work. We have the data to support that as well. Overdosing on vitamins, another one. You need some vitamins, but you don't need to overdose it. So those are top 2 on my mind right now.
Any crazy things you've heard from some of your clients, patients?
I know that carbs are bad. Carbs are horrible for me. When we need the complex carbs to help balance our blood sugar, and or fats are bad when we need them to carry our hormones, our happy hormones. And I think the biggest one that I found is that the power is outside of them. When there's a lot of things they can control just in finding daily routines and
like as an example, what do you mean by that?
Like having a routine, like I was talking about the journaling, writing 3 things down, or having something that they know they can control that will help boost their joy.
One issue that has come up among some of our members is about privacy. in terms of when they're sharing their medical information with their healthcare provider. Maybe somebody has an issue with substance abuse, alcoholism, or something else, and they want to make sure that their medical history stays private. It doesn't. Their employer isn't going to find out about this dark health secret that they have, that they're afraid that might impact their future employment. How do you safeguard and make sure that your patient's medical information remains private?
Yeah, I could start. You know, the HIPAA is a healthcare portability law that really makes sure that we've got that baseline of what's needed. But on top of that, we've really raised as a top concern, if you even, and there's digital fingerprints, if you even go into a chart that you don't have any business, you're fired. There's no second chances. I mean, we treat this as the utmost importance. We have the data because it's there to help you. We do not share it with VEBA. VEBA doesn't know about it. We can have aggregate data, meaning, hey, your population, this many percentage got their vaccines or things like that, or got their mammogram done, but we don't share individual data, period. There's no ifs and no buts.
So you would want patients to know what?
We would want them to develop that trust again, that we do safeguard. We treat this as gold. We do not share this with anyone who is not relevant or doesn't need to know. If you don't need to know, you're not there. And if you even go in, you're out.
So your medical information is private.
It's private.
Yeah, that's something that people think about very often. Well, let's talk about mental health and well-being. Mental health, especially post-pandemic, has become a huge thing. There used to be so much stigma involved with having mental health issues. That we seem to be chipping away at that, wouldn't you say?
I fully agree. Yes. There were many people who previous to COVID really felt that, seeing a therapist or approaching mental health issues somehow made them weak, and somehow they were, failing at life. And one of the things that COVID did for many of us was made people feel that they were failing at a few things because we no longer had the resources. In that, though, became this collective place where people were starting to talk about their needs in a different way. And so we really started to depathologize some of these symptoms and issues. So because people were feeling isolated and depressed and anxious on a collective level, there was more comfort talking about that. And so we've seen the aftermath of that. We've seen the uptick in appointments and demand in mental health because people are more open to talking about those things now.
And as a physician, that must be a very positive thing for you, that people are more comfortable coming to you for help.
Yeah, absolutely. A lot of people have been dealing with this in silo and by themselves, and that is not healthy because, again, physical health and mental health are tied together. They're integral to each other. You can't have one without the other because one will break down the other, both ways.
And are there daily small things that people can do on a daily basis to promote their mental health, to keep the stress at bay and maybe lower their blood pressure in a natural way?
There is. You brought up such a great point about journaling. Journaling puts your mindset in a different place to understand your situation. So have that situation awareness so you can see a 360 to understand your picture. To get to there, you really need to be mindful of where you are before you even get to that journaling place, to understand yourself. And getting that is the first step to getting to the rest of physical health as well.
What are some of the signs and symptoms of maybe, normal day-to-day mental health challenges? Just things that happen to most of us at some point in our life.
I know. I would just say overwhelm, or feeling a little disconnected, or maybe feeling that you're the only one, or, little things that can, if not treated, then come into big things. So knowing that there is resources, there are places to get help, and
What do you see in your practice, Crystal?
Yeah, trauma and depression, as well as anxiety, it has this ability to skew our perception. And so it's really important that when we're starting to feel, a good indicator, when we're starting to feel like we're the only one who has felt any of these things, that can absolutely be an indication for you that you should seek help at that time because the perception is off. And so that is really the biggest obstacle that I come across. When people can kind of get past that barrier, they end up doing much better. And so things like isolation, withdrawal, irritability, sudden changes, life events that are changing really quickly, those can also be indicators as well.
Are they open with their mental health challenges?
It didn't used to be, but I think you're getting some great advice here. You are seeing it now. You're seeing people come and are willing to talk about it. And to me, the extremes of things are always bad. You can't have too much stress, or you can't be, stress and rest. You could be too much rest is bad as well. We need stress, but we don't need too many of it. If you end up just resting all the time, can't get out of bed, can't do anything, that's just as bad as being so stressed that you can't do anything. So finding that balance is really the key. And right now, people are coming because of COVID, because of this demystification and destigmatization of mental health. It's much better, and people can find that they can move on and start focusing on their mind as well as their body.
So when you have a patient, a client come to you, and you can tell that they do need some help more than the average run-of-the-mill stressed out person, what kind of resources are available? What do you do? How do you help them?
We have great resources through our EAP, Optum providers, and in-house providers. So there's many avenues to find help.
And maybe you see it before they do, that maybe someone is unstable and they don't know that they need help. How do you let them know in a gentle, compassionate way that you need to take this up another notch?
Yeah, one of the things I really use in every assessment, so beginning of treatment, are the 8 dimensions of well-being. So when we're able to look at all of the dimensions, such as physical health, emotional, social, financial, and there are 8 of them, and we really score each of those areas, it gives us kind of this concrete number of where people are strong and where they can use more help. And so from there, we can plug them in to the right resources. So at VEBA, we have things like yoga, mindfulness, sound healing, cooking classes. So you can see how those kind of span all of well-being.
And Dr. Sang, what is your advice to people? How do you handle a situation like that?
Yeah, no, I was going to focus a little bit more on the family and friends area, because if you start to see mood changes, irritability, if you start to see physical changes, meaning they're not the same, or if you see cognitive changes, those are signs that, hey, maybe your friend needs help or your family member needs help. And what you can do, I think, same thing as a physician, you can listen and be their advocate. Just listen to them. And then once you build that, you can start recommending, hey, let's go see someone together. Let's see how we can get you the help that you need. Often family members and friends are the first people who notice these things. And just being a friend there to help someone and kind of reach out and guide them to the right resources is important. And once they get in the door, there are so many options available then in terms of how do we best help them get to wellness.
And I would imagine, Crystal and Michelle, you see that more than anything, people that have mental health challenges.
Yeah, you notice not a lot of eye contact, or just feeling low, not knowing what to do.
And how do you start the conversation to get them the help that they need? Because you would be the one to just encourage them, right?
Mm-hmm. And a lot of that is the listening. When they notice and they feel that someone is deeply listening to them and are able to communicate, and they build that trust and have that open resource, it really helps tremendously.
And so when it comes to questions that you wish patients would ask you more often in terms of mental health challenges, what advice would you have to patients out there, to people that maybe how they bring it up to you?
Well, oftentimes people feel, again, like they're segregated or alone or the only one experiencing that, and that is part of the human condition. And so I really encourage people to share their strengths and then also their areas of deficit so that we can begin to identify those. And then from there, we normalize those. So a lot of times I do use stats with patients so they understand the number of people or percentage of people experiencing something like depression, generalized anxiety, or even PTSD. The numbers are quite high.
Do you think the stigma has been taken out a little bit of mental health illness and issues?
I think a little bit. I don't think we're there yet, but definitely people are much more open about it.
I think they really resonate with mental health is like working out. You need to work out the muscle of your brain and all the connections. That resonates well with people.
In closing, I would like to thank our expert panelists once again for joining us in this Health and Wellbeing Roundtable and for the valuable information that they shared. We hope the discussions and expert insights provided help empower you to take control of your health and well-being. And remember to implement the tips and habits shared to make a positive difference in your health journey. Whether finding the right doctor, starting a conversation about mental health, or focusing on small, daily changes that you can make, we encourage you to actively participate in your healthcare decisions. Together, let's strive for a healthier and happier future. Thank you once again for being a part of this important conversation. For more information about California Schools VEBA member benefits, please visit the website and follow California Schools VEBA on social media for more information about resources.